Imagine just for a second that you got really sick. Lots of people, doctors, nurses, family, and friends, will be wanting you to get better. To get better, you will need to interact with the healthcare system. And sometimes it's not clear who is supposed to do what and why. A lot can go wrong if we don't get this right. You might get treatment that you don't want and can't benefit from. Yes, it does happen. Or you might not get what you do want and can benefit from. Yes, this happens too. If we don't get this right, there are consequences for you and for the system. So how do we get it right? In Ontario, the Healthcare Consent Act tells us. So this is how it works. Each person has a specific role. The doctor's role is to figure out what's going on, what treatment might work, and propose a plan. The doctor should ask you before doing anything. This is called obtaining consent. Your role is to get all the information you need from the doctor, ask all the questions you have, and then choose if you want to consent or not. You can always say no. The only time you can't say yes or no to something yourself is when you're incapable, which, by the way, you have the right to appeal. If you are incapable, there is a new person who becomes involved. This person is your substitute decision maker. The law says everyone has a substitute decision maker. This person acts as your substitute. That means he or she has to base decisions about your health care on your wishes, your values, and your beliefs, not his or her own. The substitute decision maker is just filling in for you while you're incapable. And actually, if the substitute decision maker doesn't follow your wishes, the law has a way for the physician to challenge them. So, who would be yours? Choose the right person, a good substitute decision maker, someone who will follow your wishes when you are incapable. Getting all of this right is good for both you and the system. The right treatment at the right time in the right place is going to work only if the right people are in the right roles first. So know your role and do it right. The others are already taken.